Hello everybody, it's Laura here from Laura Cully Hypnotherapy. I'm based at Serendipity in Honiton High Street, and I want to talk to you this month a little bit about Generalised Anxiety Disorder, or GAD or GAD. So obviously we all experience anxiety and worry from time to time, and that's perfectly normal. Usually there's a good reason for this. So it may be that something is very important to you and you want to do really well. So it could be that you're giving a presentation or going for an exam. And it's natural to get anxious and a little bit worried over things like that. And it just drives us to put more effort in and to do well. We also may get anxious or worried if somebody is ill, or if we've got money problems, or having a particular problem with our children or something like that. Usually there is a reason for it, and if somebody were to ask you, you could tell them, well, yeah, I'm worried about this or that, or this is making me anxious. So generalized anxiety disorder is different in that it is your kind of default setting, I suppose, in a way, that you always feel anxious, and a lot of the time you don't know why you're feeling anxious. So, you know, somebody might ask you and you can't really pinpoint what it is that's happening and why you're feeling a sense of anxiety. So it can cause a lot of different kind of mental and physical symptoms. So it can make you feel quite restless and quite agitated. You might feel more short-tempered than usual, and people might have noticed that you're a little bit snappy. It can make you feel tense and a bit on edge, so it can lead to physical symptoms such as aches and pains, where you're physically feeling tense a lot of the time, finding it very difficult to physically relax. It can cause the sort of symptoms that you might find in panic disorder. So you might actually find that you're getting a lot of palpitations, your heart's racing or jumping all over the place. You might start to feel dizzy. Lots of different things that it can cause. So you can have a read through anyway, because I've written a blog about this. So do have a read through and look at the different mental and physical symptoms. So if you suspect that you might have general anxiety disorder, it is important for you to go and speak to your doctor, and just make sure, especially with the physical symptoms, that there's nothing else going on. I mean, it can cause, you know, upset tummies and nausea and things like that. So it's important that you don't just put all this down to anxiety, but you actually go and get checked out. Make sure there are no physical reasons. So what can you do about generalised anxiety disorder? Well, exercise is always good. We're always being told this, aren't we, that raise your serotonin levels and that can make you feel a lot better. And of course that's true. And also relaxation, spending time on hobbies, things that you enjoy is really important. We get so busy getting kind of wound up in work and family life and all those other things we have to do. Sometimes we forget that it is really important just to take time out for yourself. Get out in nature, have a walk, you know, do some exercise, do a bit of meditation or a bit of self-hypnosis. So what I was going to talk you through today was the technique that I write about in the blog. So if you are feeling a little bit anxious, you might want to join in with this. Now, please make sure that you're not driving or operating machinery or doing anything where you need to be really alert, obviously, because I'm going to ask you to close your eyes and relax a little bit. So if you would like to join in, then if you'd like to do that, just find somewhere you can sit and relax just for a couple of minutes. It's a very short technique. And then just close your eyes and really focus in on yourself and your feelings. And then notice where you feel that sense of anxiety in your body. So really start to tune into that. Some people say they feel it in their chest or their throat. Other people feel it in their tummies. Some people describe it as a tightness, like a knot. I just want you to tune in and really feel that anxiety. Don't run from it. Don't try and bury it or ignore it. Just feel it. Just allow it to be there. Just for a few moments. And then what I'd like you to do is actually think of this anxiety as not as you, not as part of you, but as something separate. And it may be inside your body, but it's something separate from you. So could you give it a colour? What colour would that anxiety be? If it were an object, what object would you imagine it to be? Maybe it's just a shape. Is it moving or is it still? And then when you've really begun to imagine that anxiety as an object, something separate from you, or a colour, or both, I would like you to start to change it, start to take control of it. So if it's a particular colour, can you begin to change that colour to something more comfortable? So for example, if it's a bright red, could you maybe imagine it turning into a lovely shade of soft pink? Or perhaps you could turn it into a green or a blue. Something you would find more calming. If it is an object, something such as a knot, can you imagine just loosening that knot a little bit? Just imagine as you breathe in, you're changing that anxiety. As you breathe out, feeling more and more relaxed. If it's a particular shape, what shape is it? If it has sharp edges, could you imagine rounding it out? And then what I'd like you to do is imagine that whatever it is in there, you're beginning to shrink it. Feel it getting smaller and smaller, whether it's that colour, that shape, that object. Imagine it getting smaller and smaller. And you're feeling it less and less, so you're just letting it go. Try and make it as small as you possibly can. And then as you breathe, just imagine breathing out that anxiety, just letting it go. Breathing in calm and confidence. Breathing out that anxiety, just letting any of that uncomfortable feeling go. Good. And then open your eyes and just gradually bring yourself back to the room. Okay, so this is something that you can practice whenever you feel the need. So whenever you have a couple of minutes, just practice this, because it does take time. So just practice breathing in calm and relaxation, changing that feeling of anxiety, changing that object, and then breathing it out. Now, of course, if you would like help overcoming anxiety, increasing confidence, overcoming phobias, just help with insomnia, please do get in touch, because I help with all these things. I suffered with generalised anxiety for many years, so I really know how it feels. I know how uncomfortable it is. I always described it as this impending sense of doom. That's how it always felt to me, like I was just waiting for something horrible to happen, and I didn't know what it was. So I absolutely know how you're feeling. So please do get in touch, even if you just like a chat about, how hypnotherapy might be able to help. So I will be back to talk to you in April. So I hope you enjoy the rest of March. Thank you very much for listening. Bye.